This is Doug Brunk for Global Medical News Network, reporting from the annual meeting of the American Society of Nephrology in Denver. According to a study by researchers from the Medical College of Wisconsin, patients with end-stage renal disease who are admitted to the hospital during the weekend face an increased risk of death.
We especially looked at in terms of their mortality and in terms where they get discharged once they are finally ready to get discharged from the hospital. And what we found was that there was significantly increased mortality in dialysis patients who get admitted over weekends in the hospitals in comparison to weekdays. And there is a much higher proportion of these patients who are finally discharged to other healthcare facilities rather than being discharged to home in comparison to their counterparts who get admitted over weekdays. We should tread cautiously towards patients who get admitted over weekends in comparison to those who get admitted over weekdays, because one, the dialysis population is anyways a very fragile population and they are prone to much higher morbidities and mortalities in comparison to patients who are not on dialysis or rather who have normal kidney function. And when these patients get admitted over weekends in comparison to weekdays, we have shown that they have poorer outcomes. So we should tread cautiously towards them and keep it at the back of our mind that these are a group of patients who can have bad outcomes. And so we should take more care in managing these patients, especially over weekends.
For Global Medical News Network, this is Doug Brunk.